Monkeypox, polio, and yes, COVID-19. A lot to talk about with Dr. Ruth Berggren, infectious disease specialist with the Long School of Medicine at UT Health San Antonio, who we have not seen in a while. So we're glad we got a big list of topics to cover with you today. Let's start with monkeypox right now. Really, I think a huge question for people is who is at risk for this?
Sure. So monkeypox is related to the smallpox virus, but it's a milder version. And this has come from the animal population, some kind of rodents, and it got into the human population. Now, anybody can get it, but who is getting it right now is people that are at risk because of their sexual practices. So we are seeing it being primarily transmitted sexually, but not only that way. It can also be transmitted by skin-to-skin contact and occasionally from respiratory particles, but this seems to be less common.
My question for you, doctor, is I keep getting questions from viewers who are older who had the smallpox vaccine, which they stopped giving out, I believe, in the early 70s, and they keep asking me, would that cover me in this type of situation?
So the answer is you have some protection, but we haven't had this particular circumstance to test it. So we'll find out. Really, the people that should be worried are those who are at high risk because of sexual exposure, multiple sexual partners, including men who have sex with men, but not only that population. So it does seem to be primarily in the population that has frequent sexual exposures.
And we know that there have been some cases transmitted to children, a small number, but it sounds like for all the parents out there, this is not something we're expecting to see spread rapidly among kids.
No, certainly not. And, for a kid to get it, they would have had to have close skin-to-skin contact with somebody that had some big old blisters that are kind of pus-filled on somebody else. And these are not subtle rashes. They're not slight. The monkeypox rash is usually very painful. It usually happens in someone who's feeling sick. They have a fever, they have headache, they have swollen lymph nodes, and then they get a very painful rash that starts out as blisters that then get filled with pus and eventually turn into scabs before they fall off. So it's not really a subtle presentation.
If we can shift gears from monkeypox to COVID real quickly, we keep hearing about another booster shot that could be open to more folks. Now it's over 50 and immunocompromised, hard to say. When will normal folks like me who are over 45 will be eligible for one of those boosters for COVID?
Right. So we think that people who are under 50 and not immunocompromised, like you, will be eligible for a new booster, something that's more focused on the variants that have been circulating recently. The Omicron variants will be available sometime this fall. We haven't been given a specific date, but definitely stay tuned for that, because when it becomes available, it will be a very good thing to go and get. You'll be able to get your flu shot as well, and you should be able to simultaneously get your flu shot and your COVID booster.
And that's one of my questions, too. I know earlier on in the pandemic, we talked about the likelihood that eventually a COVID shot would be like a flu shot, something that is annual or is seasonal. So we're still talking about boosters, third and fourth rounds. Are we closer to that point where it seems like this is going to be a once-a-year thing for people?
Yeah, most infectious disease doctors that I speak with and that I work with think that this is going to be with us kind of like the flu. As you know, you need a different flu shot every year because the flu changes, it mutates. And so the question is, how frequently will we need to get it? And will it be a once-a-year shot that we get every fall like the flu shot? We'll have to wait and see. But that's what we seem to be marching towards as these variants continue to appear. And as they change, they seem to be getting more infectious, easier to spread, but they don't make you as sick.
Shifting gears yet again to another one that we're keeping an eye on, and that is the reemergence of polio. We've seen it in New York. A lot of questions about that. Most people are vaccinated when they're children. What kind of protection do we have if you've been vaccinated for the polio?
If you are fully vaccinated against polio, you're fine and you don't need to worry about it. Children need to get 4 shots. They get them when they're babies at about 2 months and 4 months, and then again between 6 and 18 months, and then yet a 4th shot around 4 to 6 years of age. Now, there are some children who never got vaccinated or who only got partially vaccinated. They didn't come for the whole series. Those kids are at risk, and they should go ahead and get fully vaccinated. An adult who was never vaccinated needs 3 shots over a period of time, and if an adult thinks that they were only partially vaccinated, they can come on in and get an inactivated polio vaccine shot, and that should take care of them just fine. So this is an important thing to pay attention to. Polio can be very serious. It can paralyze you, but it's entirely preventable. The vaccines really work.
And these vaccines, they are standard vaccines now that are given as part of the vaccination schedule for kids in that age group, babies that you're talking about. This is not something, if a kid is up to date on their vaccinations, a parent doesn't really need to double check that. They should have received it.
That's right. And you're right, these vaccines are nothing new. They're decades old in terms of the technology. This is an old-fashioned, inactivated polio vaccine. We don't give live or oral polio vaccine in the United States anymore.
If you are vaccinated, you are protected. Dr. Ruth Berggren, as always, great to see you, and thanks so much for being here.
Happy to be with you, Myra.